Hello and welcome to our Q&A session, COVID-19 and Sepsis, Getting Through the Pandemic. We know that there are a lot of questions surrounding COVID-19, so we've brought in an expert who's working on the front lines to manage and respond to the pandemic. I'll go over a few quick housekeeping items and then we'll get started. Sepsis Alliance develops sepsis awareness and education programs. Our mission is to save lives and reduce suffering by improving sepsis awareness and care both for the public and healthcare providers. And just as a reminder, the information in this webinar is intended for educational purposes only and should not be considered advice or opinions of Sepsis Alliance. This presentation is made possible by contributions to Sepsis Alliance from supporters like you. To support ongoing education and awareness programs, please visit sepsis.org and click Donate. I want to introduce and thank our presenter, Dr. Ryan Arnold, for taking some time during this extremely busy period to speak with us and answer your questions. Dr. Arnold is an emergency medicine physician at the Santa Ynez Valley College Hospital Emergency Department. Dr. Arnold will start with an overview of COVID-19 and sepsis, and then we'll jump into our Q&A session. Dr. Arnold, thank you so much for sharing your expertise, and I'll turn it over to you.
Sounds good. Thank you very much. And I'm a pleasure to be here. I really appreciate this opportunity to talk to our patients and Sepsis Alliance followers and really kind of hopefully provide some little more clarity on guidance on what we're facing on the front line and really help out people understand when to seek care and when to try to stay at home and avoid public contact. So let's get started and we can look into just talk about this virus in general and what we're facing right now. Just to add a comment on overall the news that is changing right now that we're seeing a lot, which is that there are rapidly developing recommendations that are coming out on a daily basis right now, and we are seeing this almost on an hourly basis. That is kind of concerning us. And what we're finding is that things that you might be told today will be changed in the next days ahead, and so a little bit of just an air of a grain of salt, a note of caution of the things that might be coming out from guidance from the CDC and the government. We want to make sure that we recognize that as data becomes more available from our own patient experience within the United States, that we will update recommendations as they come through. Today's recommendations will come at a kind of the best evidence to date to what we know and acknowledging things that we don't know as they come up. So the coronavirus that everyone is aware of is caused by the SARS-CoV-2 virus. And this is the virus that causes the COVID-19 illness. So if you hear references to these two entities, the virus causes the illness that is known as COVID-19. The challenge with this that we are starting to see is that the virus can develop symptoms that are very mild in the beginning, if not asymptomatic in the first several days. At this time, you can be viral shedding, as it is called, in which you are contagious and able to infect someone around you without any symptoms. Once symptoms do appear, they can progress and generally are 5 to 7 days after the first exposure. And then they progress and can last anywhere from 2 to 14 days long in total. The symptoms are a wide range from asymptomatic, essentially with no symptoms whatsoever in a small population of people, to those with mild flu-like symptoms, which can be fevers in some, sore throat, runny nose, signs of just mild cold, to more flu-like illness with aches and pains, and even some early GI symptoms like nausea, vomiting, diarrhea, and a recent description of a loss of sense of smell. Again, all these symptoms are possible. They are not required for the disease to be present. And that's one thing that we are going to come back to more and more, which is recognition that there is a wide range of symptoms and severities. Fever itself is present, but only in half the patients when they first get the illness, and sometimes never at all, which is, again, a reminder of the wide variety and that you can't assume that the lack of fever is therefore lack of infection. We're seeing more and more that the patients at highest risk for the complications of this virus are older adults, age 65 and older, and those of any age with underlying medical conditions such as heart and lung disease, diabetes, and other chronic medical conditions. These are cases that, while it puts you at higher risk, it doesn't necessarily change what we do in the beginning, and we'll talk about that. Right now, the recommendation is once you feel you have or have been diagnosed with the definitive presence of COVID-19, your goal is to home quarantine, rest, avoid contact, get optimize your body's response to this, which we'll talk a little bit about, pain relievers as needed, and let the virus run its course, let your body respond. More and more the questions become is, should I go get diagnosed? And frankly, the answer right now is no, we need you to. If you assume you are infected, you can speak to your primary care physician or services, but avoid that public exposure and that public care until you feel that things are becoming more severe. So what does it look like if things get more severe? We have a couple guidance here of things to look for where it starts crossing over from the infection being, if you will, tolerated and controlled by your body to more severe side effects that we're now more concerned on. Those include things like trouble breathing, pressure in the chest, any episodes of confusion, or if you're with a family member, the inability to arouse them or to get them to wake up, any signs of bluish bluish color to the lips or the face. These are not inclusive, but they are kind of the recognition of signs that are transitioning this infection from mild to severe. And these are the ones that are going to prompt medical evaluation. So the course of the COVID-19 infection is an infection that becomes in the body. And as we've talked about, and the Sepsis Alliance has been instrumental in forwarding and reminding the public of the importance that sepsis comes from the body's response to an infection of any source, and that includes COVID-19. When this infection, when that becomes associated with the body's organ system starting to dysfunction, that becomes, if you reach the sepsis criteria, and that can progress on to septic shock. We are trying to help guide the large public exposure to this illness, as well as find out those who are developing signs of sepsis early so that we can mitigate and monitor them for the progressive disease here. So here's some challenges that we are seeing with stopping the spread of this virus. The numbers are, around 18% right now that have no symptoms or very, very mild symptoms. These patients can still infect other people, which is part of the challenge. When they've looked at hospitalized cohorts of these patients with known COVID-19, over half of them do not have a fever at all in the beginning and have a long incubation time, which is going to lead this to be spread amongst many people. This can mimic other illnesses as well, starting with diarrhea and vomiting, which is not traditionally associated with the respiratory illness at first, and we are starting to see more of that happen now. We're also challenged with is the lack of testing and the results that are delayed, and we'll talk a little bit about that later on, but it is part of the issue where the assumption is I don't have it when you have a mild illness, and because of the lack of ability to test it, you can then expose someone else and infect them without knowing definitively that you had the infection. The other challenge we're seeing is that there's a high false negative rate on the PCR test. The PCR test is a polymerase chain reaction test that identifies the presence of the virus. And unfortunately, due to several factors that aren't really important, but the take-home important point here is that it can be falsely negative in patients that we know have the disease. Now, why that's important is that you might get a test done if your facilities and where you live affords that opportunity, and feel like you definitely have COVID-19, and yet the test comes back negative. And the recognition here is that yes, it might be a negative test, but you might still have it. And that's given this false negative rate, which is unfortunately where we're at right now. It's something we have to deal with. Yeah, so this has led to a large uptick in the United States detection of the virus, as you've seen here from this graph dated from March 31st of 2020, that the United States is still on an upward slope of detection. Now, this has many factors that can relate to it, many of which include a larger use of a diagnostic test, maybe in even lower severity patients. Some countries have mitigated their testing to only hospitalize high severity patients, which would then have an unequal denominator of patients that we're comparing. So it's hard to interpret these numbers, but it is concerning that we are still on an upward increasing slope of this infection presence in the United States. Everyone's heard of the flattening the curve recommendation, and this comes from a observation from the Spanish flu in 1918, in which they noted that mitigating public exposure and people collecting together, that they were able to slow the growth and the expansion of the virus. Because we are so realizing the challenge of COVID-19 with many people having mild or low symptoms, the infectivity rate is much higher than we would expect, and we are seeing a large growth in this. And so the goal here is to lessen the exposure of those in public through these, as you've seen, recommendations across the country to lessen public gatherings and allow this to stop the spread in the exponential fashion we've been seeing. The key here is to let the healthcare system, which is already straining in its ability to handle the volume that it's being asked to handle now, over a longer period of time, as opposed to a huge spike in cases that would overwhelm the system and force us to be in very dire situations with inability to manage all the cases that would need care. So how is it spread? The coronavirus is primarily an airborne droplet from someone who is infected, from their sneeze or cough, or even droplets in the air from speaking. This aspect of it is the concerning part of it, where somebody can even have mild or no symptoms and still be contagious. We are also finding a much higher rate of transmission is estimated through contact with infected surfaces. It's been shown in a recent publication that the coronavirus can survive for several hours, if not days, on different surfaces, from cardboard and copper having less time to more time on plastic and stainless steel. 2 to 3 days for plastic and stainless steel, which is rather concerning when you think of hygiene and the ability, our need to wipe down these surfaces. And all it takes is an exposure with your hands coming in contact with one of these surfaces that is infected, and then touching any part of your mouth or face, and then you've now acquired this infection. These have led to the recommendation, which is excessive and increasing our hand washing and our hygiene around this. And also what's led to the recommendations to have less communal collection of people together, because that prevents that spread of even the asymptomatic virus to hit these surfaces and be exposed in your environment. So again, these are the rationale that it's not just an airborne, avoiding someone who's coughing or sneezing, that there is asymptomatic spread, and we can't forget that aspect of this. So how to protect yourself, like I mentioned, hand washing regularly. Try to avoid touching your face, including your nose and your mouth, and clean and disinfect regularly. Stay at home if you can, and that's the optimal way to prevent yourself from getting exposed. When you must go out, that social distance that they are talking about is the 6 feet, and that is based on a study in which they looked at droplet spread from somebody who sneezes or coughs. Again, those are under certain situations, remembering that wind and other things can affect that, and the best case scenario is to avoid it. And wear a mask. We will talk about mask wearing, but that is becoming more recommendation for public exposure in the next several weeks, as we try to lower the growth of this expansion of the virus right now. So who is those at highest risk for severe illness? As I mentioned, is anyone who is age 65 or older, and that is without any any comorbid or underlying medical condition that they are having. So age alone is a risk factor here over 65. And then at any age, patients who have underlying medical conditions that they are treating, including diabetes, high blood pressure, heart disease, any chronic lung disease, including asthma, severe obesity, chronic kidney disease, those pre and post dialysis, and anyone with liver problems. All of these conditions put somebody who acquires this infection to have higher risk of developing a severe progression of this infection. So it doesn't make you necessarily more prone to get it, but if you get it, then your ability to fight it off is going to be limited or inhibited compared to somebody else without these issues. And so it's just something to keep in mind when you are trying to prevent yourself from being exposed or to isolate yourself from family members with these conditions. These are important reasons why. An additional population is those who are immunocompromised, patients under cancer treatment right now. If you smoke, if you receive any kind of immune modulated medications or immune deficiency syndromes, if you have poorly controlled HIV or AIDS, if you've been on long-term steroid use for a number of conditions, including rheumatoid arthritis, lupus, and chronic pulmonary disease such as COPD, these are going to immune suppress you and put you at higher risk in those scenarios from not only getting this infection, but also from progressing to a more severe state of this. If you live in a nursing home or in a long-term care facility, these patients are at much higher risk, not only from acquiring it, but from spreading it as well. So again, people to try to isolate in your world to avoid those contacts, even if when you could be, like we have mentioned, asymptomatic. So medications for prevention or a cure, are there anything out there? Well, right now, we are at a state where there are no current medications known. There are many things that are hitting the news of novel applications of new medications that the doctors are trying within hospital settings. Many of them are involved in ongoing clinical trials. And as I mentioned, we're learning daily about these things happening, but the number of patients that have been treated with such novel medications is so small at this point that drawing a conclusion of their utility is too premature. And so we don't want to jump to any home treatment regimens at this point for medications. If you are hospitalized with this and you discuss it with your physician, there might be opportunities to begin one of these trials, but that would be a case-by-case basis within a hospitalized setting discussed with your primary care team. And so nothing right now has been approved or indicated for the treatment of COVID-19. From the emergency department, I can tell you that there's the wide range of patients coming in, and different levels of severity has been it's been rather humbling, I would say, to see the wide range of severity of illness, of presentations and symptoms. We've seen patients that have very mild appearance of complaints, but when they have some of those key factors that I mentioned that are the difficulty breathing, the chest pain, episodes of confusion, those have indicated a severity that is somewhat subtle in its beginning. And so I think that there's an opportunity here to really try to mitigate your exposure when possible and not look towards medical diagnostic treatments to help you verify you have this if you have a mild state of the disease. And only when you start crossing into concerns for being in the severe side would I recommend kind of seeking care and evaluation in the emergency department setting. The emergency departments across the country, particularly on the East Coast right now, are just overrun with volumes of very, very sick patients with COVID-19, and it's a very kind of strained moment that we are trying to mitigate the best we can to see those at highest need. And so I think that when you think of in our Sepsis Alliance kind of family of recommendations to find these care early, that doesn't change in our underlying message, but however, during this pandemic, it's a little bit different in terms of the things we want to specifically look for, whereas the recommendations prior to that would have been to seek care earlier. And I think right now we're going to have a very specific recommendation to kind of keep you safe as a patient at home as long as possible and keep you out of the healthcare environment, which is full of patients and providers and a lot of COVID illness in that time. So we would like you to do the best we can to keep you safe until you really need to be evaluated, if at all, during the illness phase. So in referencing to the T.I.M.E mnemonic that we have used in Sepsis Alliance to help patients and families identify when to be concerned about the presence of infection that might be severe, I think that there's an important delineation to make here in that whereas temperature is an important regulator of being both high or low as an indication of infection, it's when you start crossing over to the M and the E, the mental decline, confusion, sleepiness, difficulty to arouse, as well as feeling extremely ill with pain. And I would add here, difficulty breathing, chest pain as the component where you have now crossed over and requiring evaluation. So in the beginning, the presence of a temperature elevation and suspected infection, at this point, we are so advanced that in terms of exposure and spread of this illness across the US, that I would say you can assume you may have COVID-19. But the need to then progress to evaluation by medical staff would be crossing that line and where the M and the E of this are expressing themselves. And that's where we want you to have close contact with the provider or seek medical care in the emergency department for that evaluation at that point alone, but not too early in that because of the pandemic and the risk to yourself in that exposure in that environment when you go get tested.
Okay, fabulous. Thank you. So let's move on to some of our submitted questions now. And our first question, why can't I get tested for COVID-19? I know you talked about this a little bit before, but perhaps elaborate a bit more.
Sure. So this is going to be very regional. And I will just tell you, just start from the beginning and say, if you ask your physicians that are out there in the US, we want to test everyone. We wish we had the ability to understand the true incidence of this disease in a way that was safe to obtain the test and didn't expose our patients or ourselves inappropriately, but was able to quantify the true incidence and importance of this viral spread. That being said, we're not there. So testing is limited, it's regional, and it's changing day to day. Certain areas have drive-through testing for those with minor symptoms, and they're able to do that, whereas other areas are limited and can only test hospitalized patients that are high risk or high severity of illness. Keeping in mind now that right now, it's not just about getting tested or having a test available, because the test itself has to be performed by a healthcare worker and it exposes them to you having the virus, which is a potential transfer moment. It also, if you don't have the virus and you go to get tested, you are in an environment of people with virus likely and could expose yourself as well. The other factor that is something that is challenging right now is because of our ramping up of the testing ability, is that when you test someone who has, let's say, low illness severity, you then get inside the queue with everybody else. And so now you are potentially slowing down the turnaround results for our frontline physicians and nurses and providers and techs and everyone who needs to know if they have it while they're taking care of other patients, but also our sickest patients who are in the hospital that we want their test turning around as well. And so because that is unfortunately right now one of the bottlenecks and the limiting aspect of this illness, we would rather people, unless it's going to change something, if your illness is increasing severity, and not overly look to just get tested to verify their true symptoms if they're going to be going home.
Okay, fantastic. Thank you. Let's move on to our next question. I'm at an increased risk for severe infection. Shouldn't I be tested?
So simply, I would say no, for reasons as we previously have mentioned, that unless something would change in your care requiring you to be hospitalized, even those high-risk patients who could be advanced age over 65 or with associated chronic medical condition that we know is high risk, until you cross the line for those symptoms to be present that prompt us to evaluate you, we would say to everyone, assume you have it, isolate, quarantine, and keep yourself home if possible. Only when those severe symptoms develop, like we spoke of, difficulty breathing, chest pain, confusion episodes, those are going to prompt the next level of evaluation.
Okay, let's move on to our next question here. How reliable is the COVID-19 test?
So this is one of the challenges of our current testing regimen. We can say that if it's a positive test, it's a very reliable test, which means we can believe the results and you can feel comfortable that you do have, in fact, the disease. Unfortunately, we are seeing a large number of false negatives. So anywhere from 30 to 40%, you can have the test be negative and truly miss that you have the virus. Now, that has several implications that are important, one of which is you feel more comfortable that you don't have the virus, so you change your behavior because you have a negative test and go out in the public or go out and see a family member that you were avoiding prior. That's problematic on its own for the stuff we've talked about already in terms of exposing them to you that now has, you are spreading virus when you think you are negative and you are indeed positive. So that's an important aspect to realize, that leaning on these tests that can be falsely negative, and unfortunately frequently at this point, it prompts us to not rely too heavily on a negative result. We use a lot of what's called just like clinical experience to ascertain if a patient has the presence of a COVID-like illness, and we'll treat accordingly. One of the studies that was recently published looked at patients with definitively known positive COVID-19 who had fluctuating differences in their positivity of the test on a daily basis. And that was disconcerting because we would like to rely on these tests. And I think it's important to take home that they're reliable when positive, but when negative, it can be a false negative, and best to not assume that you're fine if you have one false negative.
Okay, very good to know. Our next question here. Should I ask for a CT scan or CAT scan of my chest?
So this question comes from a lot of experience out there that has been published and anecdotally described from physicians, in which patients have a negative test, as we've discussed, but CAT scan findings or CT findings on the lung exam that show very classic COVID patterns, and that later on those patients may go on to develop a positive test when get retested. Now, while that is the case, again, we go back to the symptoms that drive the need for further care, and knowing that you have a system full of patients that are very ill or critically ill in the hospital setting. If you are otherwise well and not requiring that hospitalization, getting the CAT scan of your chest to define that you do indeed have COVID-19 will not change what we do for you. You'll still go home. You'll still home quarantine, recuperate, rest, and recover. So to that end, and on top of that, keeping in mind that the testing itself would be in a essentially environment that is exposed to other patients with known disease and a very high risk environment, you now run the risk of kind of progressive or exposure to the illness if you didn't already have it. So it is for this reason that we don't recommend routine CT scans of someone's of the chest and lungs to diagnose an illness that is not going to change what we do for them.
Okay, great. Thank you. And our next question here. What's wrong with going out in public?
So several things here. You can expose others who have the disease and contract it when they have no symptoms. So you find someone that you say, well, they're not coughing or sneezing, they look well, I can't get it from them. Whereas that close contact can definitely infect you. We've seen now case reports coming out from the Princess Cruise Lines, and the exposure of patients who were in that environment known to have positive COVID-19 without symptoms and were spreading it. And so those scenarios, which is it's not a small number, it's actually looked to be a third of the cases, was concerning enough to realize that we needed to change this on the public perspective right now. You can't assume that when you look at someone that when someone's sick. Someone who's sneezing or looks like they have the flu is an obvious one to avoid, but it's the person that you're in line with at your local supermarket who looks fine to you and yet can spread the disease. And that includes both contact with things that they touch, when they touch their face or cover their mouth when they cough, and then they touch the squash that you picked up and now you have it. These are the problems we have that are unable to be kind of mitigated from just simple mask wearing.
Okay, great. Thank you. And our next question here. Should I wear a mask in public?
So this is, again, one of the things that is going to be changing regularly and today, as of April 3rd, 2020, the CDC is expected to come out with a recommendation that anyone going out in public wear a cloth mask if you have to go out. Now, I will comment that medical grade masks, the surgical masks and the N95s, should not be worn by the public because that acquisition is going to take them away from our frontline medical staff who are already facing shortages and being asked to reuse masks and slow the use rate of these protective devices that we need when we take care of patients who we know have COVID-19. So a simple cloth mask is likely going to be the recommendation from the CDC that comes out for public at any point that you have to go out. That includes the market, that includes even with social distancing to still wear that mask. That doesn't change the recommendation that you should still wash your hands regularly, routinely. But from the mask perspective, this is kind of where I think the new recommendation will come out today.
Okay, great. Thank you. And let's move on to our next question. A few different questions here. So let's start with the first. I'm a sepsis survivor. Am I at increased risk?
So this will depend on where you are in your sepsis event and recovery. If you are recently kind of coming out of and recovering from a sepsis event, you might still have an immune system which is recovering its function from where it used to be, and that can take several months. It just depends on how sick you were at the time. And as Sepsis Alliance has been one of the leaders in talking about the post-sepsis syndrome, this has a much larger ripple effect that is much more profound than I think we've previously understood. So I would say that if you've had an event in the past, be even more aggressive on isolating yourself and preventing yourself from an exposure, monitoring for the same signs we talked about, but just really being careful on the risk. But there's a suggestion that the earlier you are in your recovery, the higher risk you are from a recurrent exposure or infection.
Okay, very good. Thanks. And let's talk about the risk if you're pregnant.
So there are some anecdotal cases of increased severity of illness in pregnant patients who contract COVID-19, although it is still early, very early in understanding this. It doesn't change any recommendations on when to seek care: shortness of breath, difficulty breathing, chest pains, altered mental status, changes in mentation or confusion. However, being aware of that and being just more cognizant of your exposure if you are pregnant, and preventing any kind of contraction of the illness, and letting your obstetrician and primary care physician know if you start to develop symptoms, so they can monitor you even remotely through either telemedicine or phone calls to discuss your symptoms as they happen.
Okay, great. And then what about the risk for children?
The one silver lining behind this infection has been that it seems to not be as severe in children, 18 years of age and younger. They generally have less severe infection. It doesn't mean they're not getting the infection. We can't even comment on the frequency of acquisition in the pediatric population, the young children, because we're not testing them, in a large number to figure this out. However, they can be a carrier, and this is the important thing. These children can be carriers without symptoms and transmit the virus to someone who is higher risk for a severe outcome, like we talked about, advanced ages over 65 or chronic medical conditions of any age. So keeping that in mind, of keeping your child away from that population and away from, in our quarantine recommendations, is because of this effect. It is good that they don't get as severe of illness as adults, but they are still a carrier that can transmit this.
Great, thank you so much. And let's move on to our next question. I am feeling poorly, but I don't have a fever. Could I still have COVID-19?
Yes, so in a single answer, the answer is yes. At this point, with the spread of the illness across the United States, you can safely assume that almost any illness could be COVID-19. The presence or absence of fever is not going to dictate it being that, and you do not require a fever at all to have this illness. In fact, as I mentioned before, it can be up to 50% of the patients can have no fever in the beginning, and even there's a percentage of patients, probably 20 or so percent that's been described, that have never had a fever at all in the entire illness. So remember, feeling poorly, feeling like the flu, muscle aches, fatigue, just wiped out, kind of all over, low energy, that can absolutely be COVID-19, and you don't require anything else further. It doesn't change what we talked about in terms of what you should do. The fever doesn't make it worse or better, but it's not required for it to be present.
Great. And then there has been some conversation surrounding Tylenol instead of ibuprofen with symptoms. Can you talk about that a little bit?
Sure. So right now, there's no conclusive evidence against ibuprofen use. That's just kind of like the take-home message across what you've heard. That at one point, the WHO did come out to recommend not for patients with COVID-19 to not use ibuprofen as an anti-inflammatory. I will say that there is evidence out there that potentially ibuprofen use in certain viral syndromes can have complications that are hard to know if they're causative or just associated. And so because the evidence is still early and there's changing, kind of unclear recommendations from like kind of world leaders, at this point, if it's possible and you can take acetaminophen or Tylenol primarily, just do that. If you feel like you're not getting adequate fever control or symptom control and you need ibuprofen, it's okay to take it. It's just kind of we're at this gray zone of evidence to know truly of a recommendation to make. What would I do with me and my family? I would recommend Tylenol primarily and see if that's an adequate enough fever and pain control agent for you.
Okay, great. Just a couple more questions left. Let's move on to those.
So this is, and this is where a lot of the questions we've seen in the emergency department and kind of the screening up front of families has come up a lot. And you can assume at this point that any sickness in your family member could be COVID-19. It's tough in scenarios where how do you home quarantine with somebody who you think has the illness? That 6 feet of distance you can still maintain in the house to some degree, to the best you can. Try to avoid that close contact extensively when possible. A lot of much more aggressive hand washing and avoiding sharing of any kind of utensils or drinks is important there. Monitor for those advanced symptoms as well. Look for kind of progressive illness and symptoms that worry us and we talk about. But do not seek care just to verify that your family member or you have COVID-19. If your family member or yourself are in that high-risk category due to age or chronic medical conditions, again, being careful at home with the person that is infected, is recommended, but don't seek care just to be diagnosed and to verify if you have the infection. Use that modality of looking for care when those symptoms of severity present themselves.
Fantastic. Thank you. Let's move on to our last couple of questions. Should I ask my doctor about a hydroxychloroquine prescription?
No. So this is a medicine that has come out in publications with variable performance in the use of applying it towards COVID-19. This medication, both chloroquine and hydroxychloroquine, are related, and they are anti-malarial medications that have also, hydroxychloroquine is indicated for use in immune suppression for patients with lupus and other autoimmune diseases. While it's being used in the hospital environment in an experimental fashion, there is no noted indication for its use there, and it is still in the discovery phase. So the use in an outpatient or an at-home setting right now is really not ready, and I don't think there's enough evidence to support it. And it is not a medication without side effects that can be severe sometimes. So at this point, wait for kind of discussion with your hospital and your physician if you become hospitalized or otherwise. I would not expect this to be something that is taken at home.
Okay, thank you. Final question here. Is it okay to exercise if I have mild symptoms of COVID-19?
Exercise, can be looked at as a stress to the body, and usually it's what we call a hermetic stress or a positive stress, and something that you want to do. However, high-intensity workouts can be an additional burden to a very stressed immune system and can push you over the edge of just too much. We do know that low-intensity workouts can be beneficial to our immune system. It can bring on positive responses from our infection-fighting cells. So I think listening to your own body, listening to your responses as how you feel. You shouldn't be short of breath and winded in a way that is uncomfortable, and really not overdoing it while you're recovering. You should really be optimizing towards health, adequate and restful sleep, good nutrition with good healthy eating, of lowering the exposure to highly processed and high sugar foods has been recommended in kind of optimizing your immune system response. But as exercise per se, nothing overly aggressive would be, I think, a fair recommendation at this point.
Okay, fantastic. Thank you again, Dr. Arnold, for taking time out of your day to answer these questions. Thank you so much.
My pleasure, and hope everyone stays healthy and safe out there.
And folks, I want to mention a few additional resources that Sepsis Alliance offers to help educate yourself and your loved ones about COVID-19 and sepsis. We have a dedicated webpage with information and resources on COVID-19 and sepsis, as well as a COVID-19 informational video, sepsis information guides, posters, infographics, and more. You can also stay up to date on COVID-19 related news and more by signing up for the newsletter at sepsis.org. Again, I want to thank you all for your support. We couldn't offer these programs without contributions from supporters like you, so please feel free to visit sepsis.org to support our ongoing awareness and education programs. And as a final reminder, the information in this webinar is intended for educational purposes only. Thank you so much for viewing this webinar, and please feel free to reach out to us with any questions.